Did you know Alzheimer's disease is the most common cause of dementia and affects millions worldwide? Let's break it down simply. Its causes, effects, symptoms, risk factors and its treatment. Alzheimer's is a neurodegenerative disease and is the most common cause of dementia, accounting around 60 to 70% of cases. In other words, it is a progressive brain disorder that slowly destroys memory, thinking, and behavior. It was named after Dr. Alois Alzheimer, who first described it. It is most common in people 65+ years, but early onset cases also exist. Let's talk about its causes. Well, the causes of Alzheimer's disease remain poorly understood, as there are many environmental and genetic risk factors associated with its development. However, the strongest genetic risk factor is because of an allele of apolipoprotein E. Other risk factors include a history of head injury, clinical depression, and high blood pressure. Now let's see what Alzheimer's do to our brain. We all know that the basic functional unit of CNS are neurons. They carry chemical messages as nerve impulses. So, Alzheimer's target them first. In Alzheimer's disease, unusual proteins start to build up in the brain in the cerebral cortex. These form clumps outside the nerve cells, called amyloid plaques, and twisted fibers inside the nerve cells, called tangles. Here you can clearly see the effects of Alzheimer's on our brain. This image compares a healthy brain on the left with an Alzheimer's brain on the right. In Alzheimer's, the brain shrinks, the folds become thinner, the spaces widen, and the inner chambers enlarge. This loss of brain tissue is called cerebral atrophy, and it explains the memory loss and decline in thinking. Let's know its signs or symptoms. Early stage symptoms include forgetfulness, like keys, names, recent events. Problems with language, like difficulty finding words. Disorientation. Advanced stage symptoms include confusion in daily life, mood changes, aggression, severe memory loss and loss of speech. There are many risk factors behind it. Age is the biggest risk factor. Others include family history and genetics. Lifestyle, obesity, diabetes, smoking, lack of exercise, low social or mental activity. There is no cure yet. The treatment available may not cure Alzheimer's, but it can slow the journey. Let's see how. For diagnosis, doctors use memory tests, brain scans, MRI. It can also be identified by the family members, like when they're elders of 65+, or even before, starts forgetting where he kept their keys, then struggles to recognize names, even family. Seeing this mid-stage or advanced stage Alzheimer's can be identified. However, early stage is difficult to be identified. For treatment, drugs like donepezil, memantine can improve symptoms temporarily. However, healthy habits like exercise, balanced diet, social activity, lifelong learning may reduce risk of developing Alzheimer's. Researches are ongoing on immunotherapy and early detection tools. So today we learned what is Alzheimer's, its causes, effects, signs, risk factors, and then its treatment. Remember, Alzheimer's is more than just memory loss, it's a journey of patients and families who need our care, patience, and compassion. While science searches for a cure, we can give what matters most today: kindness, dignity, and hope. Because behind every fading memory is a person who deserves to be remembered. Thanks for watching. Please do like and subscribe.